see it all over the supermarket or at restaurants now. Gluten-free labels are everywhere these days. For folks with celiac disease, it's literally a lifesaver.
But a lot of parents are introducing gluten-free diets to their kids without ever even testing for celiac disease. Once again, joining us to talk about the potential risks and benefits, clinical professor of pediatrics at the University of Washington School of Medicine, Dr. Don Shifrin. Good morning and welcome back.
Good morning. Thank
you.
you.
First of all, let's talk about what exactly is gluten.
Well, gluten is a protein found in wheat products, barley and rye and a couple other minor grains. And basically, it is something that triggers an immune response in the small intestine, in the gut, of genetically susceptible individuals. And it's probably, the estimate's about 1% of the US population can be having a possibility of celiac disease. For kids with diabetes, for kids with thyroid disease, with autism perhaps a little bit higher, and those kids should be screened, by the way. And also there's about 5% of people that have something called non-gluten sensitivity, where they are sensitive to they're sensitive to the protein, but they don't test positive for it when they're tested. So this is medical nutritional therapy that's gone pretty much mainstream, and it's actually gone rogue because it's now looked at as a healthier alternative for people, because there's a big industry about it now. 10 years ago, there wasn't a big industry. You had to order this online. So again, parents are saying, because this is healthier, celebrities endorse it, sports icons endorse it, it should be a healthier alternative for my youngster, but there are downsides.
And so what are those downsides? I'm very interested in that, because I, for one, did also think that gluten-free meant healthier. You're erring on the side of safety there.
Well, like I said, this is a fad diet that's sort of gone rogue. And again, the downsides are, number one, it's expensive. Number two, for people with celiac disease, this is a lifelong commitment. And so it's very tough to keep to this, because there are a lot of products that have wheat and gluten in them that aren't labeled as such. And so it's expensive. The downside is there's less fiber in it, and fiber is very important. Micronutrients in wheat are very important. And for people that have celiac disease, one crouton, 50 micrograms, or 50 milligrams, excuse me, can trigger an immune response. So they're very sensitive. And again, gluten is not a toxin any more than peanuts are a toxin if you don't have peanut allergy. So again, this is not a toxic substance that you have to avoid if you don't have to. So parents, if you think your child may be gluten sensitive, please see your pediatrician. Make sure your pediatrician knows about the North American Society for Pediatric Gastroenterology guidelines for testing. And again, try not to get too shall we say, aggressive in saying my child has some symptoms that I think are related to gluten without getting them tested. But for kids that are on a gluten-free diet, even 1 to 2 months off gluten can interfere with the accuracy of the tests.
Oh, wow, interesting.
So how do you know, or when would you know to bring your child in for testing?
Yeah,
What's going on with their system that we should be aware of?
Well, most youngsters will have difficulties with their abdominal system. They'll have pains in their abdomen, they'll have diarrhea, they may have constipation, they may have chronic headaches. Parents have a constellation of symptoms, and celiac disease can be a conundrum to diagnose, especially when you get a little older. So again, that's the trigger for them to say, let's talk to the pediatrician, and maybe it might be a good idea to mention this because I'm thinking about taking my child off gluten.
Right, and don't self-diagnose too, right? Like I said, talk to the pediatrician. Don't just assume that all of a sudden you think no gluten is better for your child.
That's great advice for almost everything, including going on a gluten-free diet.
So in terms of adults on gluten-free diets, because I have a lot of friends who say, you know, I just feel better.
Yeah. And again,
I cut out gluten and I feel better, and so clearly they do feel better, but it sounds like you don't recommend that.
They don't have celiac disease.
well, again, it's a lifelong commitment. It's tough to be able to do, and they're going to sneak gluten in somewhere. And the subjective versus the objective, the placebo effect is rampant, where we're now feeling better because we've done something which we think is positive. So again, for adults, again, know that fiber is tough to come by. For kids that don't eat vegetables, that don't eat beans, that don't eat a lot of fruits, it can be very difficult for fiber. It can be very difficult for them to get iron and calcium and also vitamin D on a gluten-free diet. So parents have to be very aggressive about knowing this is medical nutritional therapy, and if they're thinking about doing that, at least see a nutritionist that can help you correct those dietary deficiencies.
Perfect.
Dr. Don Shifrin, thanks for coming in.
Always
you
a
so
pleasure.
much.
Appreciate it, spending so much time with us this morning. We'll see you